My name is Keith O'Connor. I'm one of the enhanced treatment practitioners here at Newport. I'm going to talk about what we call a mini ACE. It's a mini Addenbrooke's cognitive assessment, really, or examination. So it's a cognitive screening tool. So the mini ACE will assess 5 cognitive domains: attention, memory, verbal fluency, language, and visual-spatial abilities. So we very often will complete one of these mini assessments with our clients who may be using alcohol to excess. Sometimes they may suggest that there's a possibility of alcohol-related brain damage, but the test will only take sort of 5 to 10 minutes to complete. Higher scores of the test would indicate a better cognitive function. So it's scored out of 30, so the higher somebody will score, they will have a better cognitive function. So what's the purpose really of this mini ACE? Is to identify sort of dementia, detect early cognitive decline, such as mild cognitive impairment. It can also monitor disease progression. And like I said, it is a bit of a screening tool that we use to identify if somebody possibly could have alcohol-related brain damage. However, no individual screening tool method should be used in isolation. So it's not just the scoring of that tool that would be useful, because we need to consider some cultural bias, perhaps the age of the individual, their education, the environment in which they live in, the time of day, the mood that they present on the time that we do the assessment. So like I said, the mini ACE is part of the process of determining a diagnosis, but we at GDAS do not diagnose. But dependent on the result of the mini ACE, we will refer clients to ABDAS, which is the Aneurin Bevan Specialist Drug and Alcohol Service, for further assessment.